Baru akibala song kurem kidon ye kejing terang ban penyar ye utnum utendai bat ye la kakur kejat da kabayok kun bungut. Handai le si kidon 4 kilong yeng ki bawat apdeng kejing song kurem kabala bun snem kimla ban yok kun yok ti. Ban sotu kambhai kan ye UPCN mentang tayo ulai keren bat ka Dr. Arpita Sarma kabalong ka Chief IVF Consultant jong ka Janita IVF Center Guwahati. Kani ka doktor, kabala trei bat aju sumar mentala palat kat saus nem tam. Kala ay ke Jingbatai ke babnya halor ka Infertility. Ni ke Jingbym armet ke Kynthei. Tung ni kami mentai kani ke kubor.
How common is infertility problem? Is infertility only a female problem?
Infertility is a very common health problem. Around 10 to 20% of the couples are nowadays infertile. That means if 100 couples are trying for a natural pregnancy, then 10 to 20% of them are not able to achieve a pregnancy normally or naturally. So answering to the second part of the question, infertility is not a female problem. The causes of infertility are shared equally by both male and female partners. 50% of the causes are due to male factors and 50% are due to female factors. The most common causes of male infertility are due to low sperm count and motility due to diabetes, infections like mumps, varicocele, tobacco and alcohol use. The most common causes for female infertility are polycystic ovarian disease, tubal block, endometriosis and poor ovarian reserve due to age.
What are the treatments available for infertility?
Regarding treatments of infertility, treatment of infertility will depend on 4 factors. Number 1 is the age of the female partner. Number 2, semen analysis report of husband, tubal status, that is the tubes are open or not, and duration of infertility. So if the condition of infertility is mild, like tubes are open, semen analysis report is normal, age of the female partners is less than 32 years and they are married for only 3 years or less than 3 years, then we will go for simple ovulation induction with some good medicines, and followed by we will plan their relationship or what is called is time intercourse. And if the cause of infertility is moderate, or what we call it moderate infertility, like tubes, one of the tube is closed, semen analysis report shows low sperm count, age of the female partner is more than 35 years and they are married for more than 3 to 5 years, then we will go for intrauterine insemination, wherein we push the highly motile sperms, washed motile sperms into the uterine cavity of wife at around ovulation. This simple procedure gives a very good success rate in such conditions.
If sperm count is very low, is pregnancy possible?
If the infertility is severe, that means both the fallopian tubes are blocked, semen count is very low, like less than 5 million, age of the female partner is more than 38 or around 40, and if they are married for more than 10 years, then we will go for directly IVF or in vitro fertilization. If the sperm count is very low, is pregnancy possible? Yes, it is possible through the procedure of intracytoplasmic sperm injection. In short, we call it ICSI. In this procedure, we select the sperms under very high power microscope and we inject the sperms directly into the egg of female partner. With this procedure, we can achieve a pregnancy with less than 1 million also, or with the conditions of agiospermia also, where we don't find sperms in the semen sample or absent sperm. It gives a very good success rate with ICSI. So if the sperm count is low, nowadays we don't go for these donor samples or donor sperms. We directly can go for ICSI procedure.
What is IVF and how it is done?
IVF is a procedure where the fertilization of the egg and sperm is done outside the human body, that is in the embryology lab. In this procedure, we take out the eggs or the follicles of the female partner through ultrasound guided. A procedure which takes around only 30 to 40 minutes under short and general anesthesia, and these oocytes are then inseminated or injected with the sperms of husband. Embryos are formed inside the embryology lab, and then these embryos are then pushed back into the uterus of wife. So this is what is called IVF or in vitro fertilization. The injections which are given for IVF are very painless, patient friendly, and the whole procedure takes around 12 to 14 days. Regarding the success rate of IVF, it depends on the age of the female partner. If the female partner age is less than 32 years, then it gives a very good success rate around 50 to 60%. But if the age of the female partner increases, likewise the success rate also declines with that.
Doctor, is IVF affordable?
Regarding the affordability of IVF, it costs you around 1.5 lakhs to 1.7 for one IVF cycle with all the investigations and medicines included.
How will the people of Shillong approach your center, and what is the time of visit to Shillong Children's Hospital?
The people of Shillong can approach us in Children's Hospital from 10th of September onwards. We will start our fertility center in Shillong, and if they have any queries or common questions regarding their problems, they can surely contact us.
For further details, please contact www.janitvaivf.com or contact Janitva IVF Center, Shillong.